Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Iron poisoning, HEPCIDIN activity in hemochromatosis. When we talk of iron poisoning, it is a reflection of a situation of taking so much iron. Iron is a substance that is not excreted nor urinated out of the body. If there is any experience like that, there is no pathway for it. But if there is hemolysis or ulcer, lysis and what have you, it could come out with a fecal stool or at times in the urine. But the truth is, you now look at how is this iron maintained in the body. That's the role of HEPCIDIN, which is just recently discovered hormone, a small peptide that is very useful in regulating the metabolism of iron. Iron is very useful, like I've explained in so many slides. If you do not want to have anemia, you need iron. Iron is also very useful in other processes of the body. The iron anemia is when the iron is low. The hemoglobin usually use the iron to trap oxygen, and that oxygen is what is dispersed to the cells of the body. But when you now have a situation of iron poisoning, that is where the iron deficiency has been corrected more than necessary, you now have people taking supplements of iron, especially in children. It becomes iron poisoning, which will now create free radicals, because iron in itself is useful in the hydroxide free radicals production, and these are radicals that attacks the heart, the liver, almost all important cells of the body, that will now destroy them and really create that uneventful death. But like I have said in the topic, the HEPCIDIN has an important role in reducing the iron. Instead of the iron being present in the blood as free iron, since iron is transported in the blood as transferrin, it is bound to a protein called transferrin. The ones that are in essence are the free ones that really attack all the other cells of the body. So HEPCIDIN helps to the effort of storing iron. Once there is an excess, that experience, it stores iron in the liver as ferritin. HEPCIDIN also help in making sure that the small intestine absorb if there is anemia, the iron that is coming from the exogenous area, that is from our diets. The role of the laboratory needs to be emphasized at this point. The laboratory is able to now check when there is excess or inadequate. That is, by performing serum ferritin test or the transferrin iron-bound test, is able to tell us whether there is overload of iron or there is normal level of it. Because when the levels are high, it's indicative of something, and when it's low, all these I will expose in the slide section when we really talk about the laboratory diagnosis. We should also take note that the idea of hemochromatosis is an hereditary disease of overload. Iron poisoning in itself is an acute toxicity, which it happens where you have supplement excess or blood being taken, transfusion being taken too much. Or whereas in the case of hemochromatosis, you are talking of the hereditary disease of iron overload, and the appearance is very serious, but the role of HEPCIDIN would also be exposed, expatiated in the slide section. So as usual, click the like button, subscribe, and join as I make more exposition of what we mean by iron poisoning, iron overload, hemochromatosis. The outline: objective introduction, signs and symptoms, laboratory diagnosis, and finally treatment. The objective: to expose the regulatory activities of HEPCIDIN in a situation of iron poisoning or iron overload, how the medical laboratory investigations could confirm the condition for the necessary effective treatment of the condition before it damages other vital organs. The introduction: iron poisoning refers to acute overdose of iron, particularly in children. You have children taking supplements, even on their own, probably thinking it's sweet because it's sugar coated, and there is that experience of iron poisoning in them. Children may show signs of toxicity with injection of 10 to 20 milligrams or more, especially of elemental iron. Whereas iron overload refers to chronic conditions of iron overload, a condition where iron builds up in the body over years, often refers to as hereditary hemochromatosis, a term first used in 1889. HEPCIDIN, on the other hand, is a hormone produced by the liver and acts by inhibiting intestinal iron absorption and iron release from hepatic stores and from macrophages, recycling senescent erythrocytes. Increased HEPCIDIN level have been associated with anemia of inflammation, and HEPCIDIN deficiency may be the common pathogenic feature of hereditary hemochromatosis. More on HEPCIDIN activity. HEPCIDIN is homeostatically regulated by two factors: iron and erythropoietic activity. Iron increased plasma, and stored iron stimulates HEPCIDIN production, which in turn blocks dietary iron absorption and further iron loading, whereas HEPCIDIN is suppressed in iron deficiency, allowing increased absorption of dietary iron and replenishment of iron store, as earlier explained in the video I did. Thus, the feedback loop between iron and HEPCIDIN ensures that plasma iron concentration is tightly controlled. Hereditary hemochromatosis is primarily caused by a deficiency of HEPCIDIN itself, or by the body failure to produce enough HEPCIDIN in response to high iron level. It could also be as a result of resistance to HEPCIDIN, called ferroportin disease type 4B. Signs and symptoms. Iron is the most common cause of pediatric deaths reported to poison control center in the United States. Iron poisoning is characterized by 4 clinical stages. 6 hours after injection, that is, these children especially ingesting the iron supplement. Acute onset, you notice acute onset of gastrointestinal symptom, vomiting, diarrhea that may progress to shock, coma, seizure, and death. The stage 2 is between 6 hours and 24 hours, may be asymptomatic, no sign, but if that first sign has come, the second sign is asymptomatic, but you need to probably check, evaluate it. Stage 3 is 12 to 48 hours. There may be hepatic and renal failures and cardiovascular collapse. Stage 4 is for 3 to 4 weeks. May include gastrointestinal obstruction after all that I had earlier said, and hepatic cirrhosis. Hemochromatosis symptoms, on the other hand, is skin darkening, bronzing, intense fatigue, weakness, joint pain, loss of libido, abdominal pain. Laboratory diagnosis: you have to serum HEPCIDIN test, and that could also be the urine test, serum ferritin, transferrin, etc. The iron studies, you find values as high as 170 mcg per DL, in iron overload and ineffective erythropoiesis. The total iron binding capacity could be as high as 450 when there is iron deficiency anemia, when it's lower than the 240 is non-iron deficiency anemia. The anemia is not as a result of the iron deficiency, so you don't need to give the supplement of iron. Ferritin could be as high as 300 in male, 150 nanogram per ml in female, and that indicates iron overload or inflammation. Transferrin, on the other hand, too, where there is iron deficiency, you could have as high as 370 milligram per deciliter, or where the patient is taking drug, oral contraceptives. HEPCIDIN could show as high as 65 to 125 mcg per dl in male, this 50 to 170 in female. Finally, treatment. Iron poisoning, especially as it concerns children, needs precautionary measures in handling iron supplements, making sure that they can't be easily opened by children. That is the container containing these iron tablets or supplements, and they should be kept near, very far away from their reach to avoid them ingesting it. It shouldn't be near them at all. Treatment for iron overload is removing excess iron from the body, which is primarily achieved through therapeutic phlebotomy, regularly drawing a pint of blood to lower iron level. When phlebotomy is not possible, iron chelation medicine can remove excess iron. Dietary adjustments such as reducing iron-rich foods, vitamin C, alcohol, and avoid raw seafood help manage that level. My effort is to help us manage our health, especially using the laboratory confirmatory test, so that we do not underdiagnose or overdiagnose a disease and cause problems like this, where you overload yourself with supplement because you don't know your present situation. So you have so many of these videos on laboratory effort at making us very healthy. So if you like it, please subscribe, introduce it to more viewers, counting over 224 videos on my channel.